I'm glad to get the opportunity to talk on this amendment bill, as it's a very serious thing that affects everyone in all of the communities, especially in Kerry. We have many failings and many issues. And I read what you're saying is that HSE's annual service plan is to be replaced with another performance delivery plan. And I suppose, Minister, that's the one issue that I've had here inside this chamber since I've come up here. Every year, budget time, we vote for X amount of millions of euros to the HSE for to provide the health service for all those people, whether it is children, whether it is elderly people, whether it is people who have had accidents or whatever it is, and who need medical attention. And we know all of the failings, and what seems to me is that there is no real accountability for all the millions that the HSE get, and we, the elected members, have no recourse to really challenge the HSE as to what they're doing or what they've done with the money, because we see on the floor of the hospital, nurses are going full belt day and night. They're doing their level best, but they don't seem to be ever enough nurses and frontline staff available yet, but there's any amount of millions being provided to administrative staff. And when there's we have a system now, and you can correct me if I'm wrong, where there's vacancies, it can happen that people will be appointed, reappointed, or whatever to the administrative side of it, and the person on the working side of it, the nurse that needs to be replaced, or someone on the floor, whatever it is, the HSE are only appointing so many, and this is what we've been told, and that's why that nurses aren't there in as plenty as we should. We have an issue going back to 2012 or 13, when Kinmare Hospital opened. It is a community hospital, Minister. It is only 7 miles from my door, and I'm very proud of the fact that because my father got the funding or secured the funding for that new hospital at that time, because he fought hard and stuck it out to the bitter end until he got the funding for it. But sadly, not all the beds are used, Minister. And what we're saying is that what we're being told is that they can't obtain staff, or that they can't get the required number of staff to man or to operate all the beds that are idle upstairs. And at the same time, this community hospital services an area from Paulgorham Bridge, which is, as you leave the N22 going for Kilgarvan and Kinmare, all the way back to the county bounds in Louth, and back to the, we'll say somewhere around Caherdaniel. For it services all those families and people who have people that need respite, and there's only one respite bed available, and still beds are empty. And we see the same in Killarney and other places, community hospital. And when we talk about Killarney, we're waiting for the new community hospital to open, and to see what use or what can be done to help the people with the old community hospital, the old district hospital, or what use. We're looking for a minor injuries unit and a primary care centre, and we've been promised at different times different things by the HSE, and we need finality to that, and sooner rather than later. I know Councillor Danny Healy-Rae is constantly raising this, as indeed other members of the Killarney municipal area. So things like that are very important. And you see, I can remember the time when my father was on the Southern Health Board, and the elected members that were on the Southern Health Board at that time, they visited hospitals, they were involved in the running of the board. And I suppose that's one of the questions. You say that there's going to be 10 new members on the board. Will there be any elected members on that board? Because I think it's very important that there would be. And you see, in the old Southern Health Board, and it was the same right around the Eastern Health Board or whatever, all the different health boards at the time, the elected members went around with doctors and surgeons, and the surgeons, and there was interaction, and they found what was wanting, and they got onto the Department of Health, and they worked together. I think we need more of that, Minister, because HSE officials, some of them are grand, a lot of them are grand, but more of them are not. They're not fulfilling the needs of the people, and they're just not doing their job like we do to have the outcomes that we want to have for the people, you know, that deserve it. And people are living older and they have additional needs, and we see all the problems that are coming along with autism and the whole thing, where there seems to be any amount of children presenting with autism. I do wish that we could find out if there's anything causing it, but we need to help those people that do present with autism. And I feel for young parents who want the best for their child, and they want their child to be the best. And it's how to say, it is a real, you know, a real ambition that they have. They want the best for their child, but the times to get assessed, the time to be assessed is taking too long, and we need to speed that up, Minister. And we really do. We're looking forward to taking a new look at the whole health system that we have, because I feel it's a daunting request. I know that many ministers have been blamed in the past, and there's so much intricate and so many different aspects that we need. The other thing is, we don't seem to have enough GPs, Minister, at any time. And if it wasn't for Southdock in the off periods, many people would be left unattended, but we just don't have enough GPs, because I feel what's happening at the weekend, that the A&Es fill up when there's no doctor services to see them. They're referred to the A&E, and they're waiting long hours, elderly people. And that's one of the, when we talk about the elderly people, sometimes they have to leave their bed, maybe an old man or a woman in their 80s, maybe close to 90, and they have to go to Tralee to the A&E. And they're sitting in the chair, or maybe in a trolley after coming out of an ambulance, and it's hours and hours before they're seen. That's not fair, and those kind of people to come out of their own warm bed and finish up in a chair in the A&E. I'm asking that be rectified, and something, the beds are there. I know the beds are there. It's the staff aren't there. We don't have enough staff. And that's a real hurtful thing, and I feel for people. I leave my phone on every night. I never turn it off, because often I get a call at 12 or 1 o'clock at night from a family whose elderly father, whose elderly mother have been waiting in a chair to be seen for maybe early the day before. And they're telling me that they have no bed again tonight. Those people were bedridden as it was, but they get sicker and they need attention. And where do they find themselves? On a chair in the A&E. I'm asking a full stop being put to that. And there's another aspect, thing that's giving me great concern. Long ago, if people got sick, maybe some of them people, they could be treated in the district hospital. But now you can't get into the district hospital unless you're in the regional hospital first. I can't understand that. Many people can't understand that. And I'm asking you as well as a minister to look at that, please, because more often than not, they would be seen after in the district hospital in maybe a week or two, and they'd be good enough to go home again for another spell. I know you're not going to make a young person out of them, but it would suffice, and it would make more use, and it would make more sense, and maybe we wouldn't be clogging up our A&Es in the regional hospital. So look, Minister, I know you so many members here inside this evening asking all their wants and trying to rectify everything. I'm asking you to do your best for these issues, especially the older people that are right behind in Tralee after coming out of a bed and maybe have to give 24 hours sitting in a chair waiting to be put into another bed. That's wrong. And then the people that can't get into the district hospital, that have to go to the regional hospital first. And you know what often happens when they're there? If there's no bed for them, a taxi brings them back home, bring them back out home again. And that's wrong. And we have the beds. It's just a matter of more staff, Minister. Thank you very much.